Hey guys, this is Caroline. Um, to start out with my presentation, I have created a Word document here where I have listed 10 case studies, and I took these case studies from our textbook Mind Tap assignments um, of chapter 28. So if you look on there, you can see like where we've already completed those. I got some of these wrong, so I went back and redid them and hopefully have the correct answers this time with the guidance that was provided on MindTap. So we will get started with case number 1. Oh, and I created this little key here up at the top to show like keywords or like things that would help us decide on like the procedure or the approach here, or the body part slash location when we're coding on the PCS. So case 1, you can kind of read through this stuff. As you can see, here's the location, the right wrist, and then the scenario you can read. The procedure down here shows that there was an x-ray completed on the right arm and wrist, which revealed a dislocation of the right wrist. So a closed reduction of the distal radial ulnar joint was performed with a follow-up x-ray, and it showed that everything was in place. The child was fitted for a splint and immobilizer. So for this one, we are going to look at the main term reduction here. We can search that on the PCS and it will lead us to C, reposition. And reposition is moving to its normal location or other suitable location, all or portion of a body part. So we're going to choose reposition instead of reduction because our index is going to lead us in that direction. After reposition, we'll choose joint because it says that it is the radio-ulnar joint. And with dislocations, obviously, that's only going to happen in a joint. So our next word will be joint. And then we will choose wrist. And then right, obviously, because it's the right wrist. I'm sorry, my cat's in the background making noises. The approach is going to be external because it says it's a closed reduction. So there's no incisions on this. No device is placed within the body. The cast is on the outside, but that is not going to be coded on this one. No qualifier is added, and we'll look at this guideline down here. The ICD-10-PCS guidelines and reporting, B3.15. It says there's a reduction. The reduction of a displaced fracture is coded to the root operation, reposition, and the application of a cast or splint in conjunction with the reposition procedure is not coded separately. So this splint and immobilizer, you don't have to worry about coding that with this because it's included with the fracture, reduction of the fracture procedure code. So let's go ahead and look at ICD-10-PCS, if I can find it. Right here. So we're going to go to the procedures tab and we're going to search reduction first and see what that leads us to. So right here you can see dislocation. We select reposition, comma, like we said, joint. comma, wrist. And then I think it was the right. Yes, it was the right wrist. So we'll select right. And that gets our first 4 characters and last character automatically. So we'll continue to look, and it was closed, so we'll do external. And then there is an external fixation device. So that's actually where the splint and immobilizer will come into play. I'm sorry, I told you that wrong. It's not coded separately, that's correct, but there is a option here on the device that shows the external fixation. There is no qualifier added to this code. So that is the first one. And we'll move on to case number 2. Case number 2, you can read through that. It's an impacted molar on the lower left side. Looks like she got some imaging done on that, and they've decided to remove it surgically. So the procedure is the patient was prepped for it. Looks like they removed some of the gum line, and they opened it up so that they could see the tooth. The tooth was removed in whole, so that's going to be a resection, which is cutting out or off without replacement all of a body part. So we will look that up on our PCS over here, and it's going to be the tooth and the lower tooth. Oh, the approach is going to be open because they did make an incision to open things up. No device is left within the body, so that's not applicable. And then single is going to be our qualifier because it signifies the amount or the number of teeth that were removed. So we're going to look on here. Resection. Oops. Tooth. Lower. And then it's filled in mode here. We're just going to select the qualifier single. And there's our code. Okay. Moving on to case number 3. A 30-year-old patient with a complaint of ear pain was placed in position and the left ear was examined using an operating microscope. The tympanic membrane was assessed after all debris was removed from the area. So that kind of helps us see like where in the ear we're looking at. We're not like inner ear. There was also noted to be a small dark color foreign object resembling a bead. The object was removed. Okay, so that is the procedure that was done. Antibiotic solution was placed in the ear canal. The patient was awoken and transferred to the recovery room in excellent condition. So we're going to be looking at extirpation, which is taking or cutting out solid matter from a body part for removal of object in the ear. The area is going to be the external auditory canal on the left, and the approach is going to be via natural or artificial opening with no device because there's nothing left in the ear, no supportive device or anything, and then no qualifier as well. So let's look at how it's coded. So extirpation, and we're going to do Oops. Let's see. Left ear. Okay, so ear, external auditory canal, and it's on the left, and it is going to be the natural or artificial opening. Yes. So we'll select that. No device, no qualifier. So there's our code for this one. Case number 4. So this one, operative report. The pre and post operative diagnosis is the same, hydrocele. So it looks like the patient was prepared. An incision was made in the left scrotum and the hydrocele is visualized. Let's see. So that tells us specifically where it's located. And it was dissected and through the incision site. The hydrocele was surgically excised. So that is a partial removal. And the drain was placed. Using sutures. So that kind of helps us know that it's going to be an open approach when we see sutures. Okay, so we're going to look up this word hydrocelectomy, which is the excision. So let's look that up here. And then that's going to lead us to this note that says C excision male reproductive system. So we're going to click on that. And we're going to look for that specific site, tunica, I'm not sure how to say that, vaginalis. So here it is. Which side was it? Left. Okay. And then, like I said, it's going to be, it looks like it's an open approach with the sutures there. And is it diagnostic? Let's see. It does not look like it's diagnostic, so we're going to say no qualifier. Yep. Okay. Okay, and then we have case number 5. And it tells us exactly what the procedure is, which is a splenectomy with no complications. Let's see, preparation. An upper midline incision was made, so that's going to be open. And then looks like all of this had to be so that we could reach the site. The entire spleen was removed, so that's going to be a resection, which is cutting out or off without replacement all of a body part. So like I said, we're going to look up the word resection, comma, spleen, which seems pretty simple. The approach was open, no device, and no qualifier. So let's look that up here. Spleen. Okay, so there's the majority of our code. We just have to select the approach, which was open, and there's our code. And I'll continue on the next video with the following, because I think we get cut off at 15 minutes.